Welcome to RHI Sociable City Interviews, where we meet with global thought leaders on nightlife and the social economy. Today we are here with Jim Mosher, a former senior advisor of the CDM Group and center director at the Pacific Institute for Research and Evaluation. This interview returned us to the 1980s and early 1990s when RHI worked with Jim and the Pacific Institute on research and policy development. Among the most important projects was developing model legislation for a responsible business practices defense in alcohol liability lawsuits. This approach was supported by research demonstrating risk reduction with business management policies and staff training.
Hey, Jim, it's great to see you. Great to catch up and get a little bit of a history here.
Yes, it's very good to see you, Jim, and we're going way back.
Yeah, well, like I said, 2023 RHI will celebrate 40 years. So it's hard to believe that all of that time has passed. But, you really established a foundation for our work with your insights, your research, and you taught me a lot about community organizing and community building. And I have a great amount of credit to give to you for the evolution of the organization and our philosophy and our approach. But why don't we go back? It was the early 80s. I had just started to advocate for the idea of server training. And back then, we only had telephones. I don't know if we even had answering machines, but I remember contacting you via telephone. So what was it that you were doing back then? What was your foundation at that point in terms of your work, and what motivated you to reach out to me?
Well, I was working at the alcohol research group that I was an attorney. I'm an attorney, and I had gotten out of law school, worked for New York State Legislature and the Pennsylvania Supreme Court, and decided I wanted to get into public health. And so I'm with this organization that does alcohol research, alcohol policy research. And just very soon after I started working there, the state legislature in California was considering a bill to essentially gut its dram shop law. California had a very broad law that was applied somewhat arbitrarily. The industry was very unhappy about it because they felt like they were being held responsible for incidents where there was no reasonable way to expect them to stop the drunk driver from leaving the bar because they didn't look intoxicated or they came in intoxicated. So there was a legislative debate going on, and I looked at the law and thought, well, we need to develop a way for the industry to have a reasonable defense. And the defense would revolve around, did they do everything they could have reasonably been expected to do to prevent this from happening? And if they did, then they shouldn't be held liable, and it should be a jury question. So I started working on a concept called the model dram shop law. And so I had to start thinking about, well, what is it we could think, what could we come up with that would be reasonable to expect the industry to do in order to prevent this? And if they follow the steps that we lay out in the law, then they shouldn't be held responsible. That way we save the law, which was clear, I thought very clearly, a potentially positive public health benefit for communities because we knew that bars and restaurants were locations where drunk driving often started. So I was trying to come up with a compromise, essentially. There was no server training at that point, as far as I knew, not in California. And then I read about you in an article, a newspaper article, and I thought, oh my gosh, there's a guy across the country thinking the same way I am. Not in the legal context, but in terms of what can we reasonably expect the industry to do to have a positive public health outcome, i.e. reducing drunk driving. And what I loved about your work was, first of all, you had come from the industry, you had worked in the industry, but second, you conceived this as not only beneficial for public health, but it would be beneficial for the industry itself, that they actually, the overservice of alcohol was not a good business practice. And so I thought you would be bringing a message, if we work together on this, that would be both attractive to the public health people and to the industry. And that just seemed like be a great collaboration and make it much more likely that it would be successful. I then applied to the National Institute of Alcohol Abuse and Alcoholism for a research grant to come up with a model dram shop law. That was, I think, 83. So, and so I started working on that. And after collaborating with you some, I started conceiving of other possible research grants for NIAAA that would further this agenda. And that's where we came up with the Responsible Beverage Service research project with Bob Saltz that we did in Santa Cruz. And Bob, if you remember, we started with that study in the San Diego Navy base that had very positive results.
Yeah, I think, there's a whole lot of history that you're talking about there.
Yeah.
Back in January of '84, we held our first conference in Boston. And
Yes.
that's when that was when the concept of server training really started to take place. Now, while TIPS had started about the same time,
Right.
there was another researcher there, Jim McKnight, who came, and he had received a grant from National Highway Traffic Safety
That's right.
Administration to research the whole server training field. And we were involved in that study where he was using pseudo patrons to see if they could change the behavior of bartenders. But
I thought his study was just, that first study was using pseudo patrons to see if they were serving drunks.
if they were
To
serving
establish that bars were a high likely area for
risk. Yeah, well, yeah, but basically, did they intervene or did they not intervene? That
right.
was, that
right.
was
He
the
didn't.
purpose
It
of the
wasn't a
study.
server training grant per se.
No. But part of it was server training because we developed a simple curriculum that he used to train people in some of the establishments, and some of the establishments didn't get the training. But regardless, we moved on to Coronado with the Navy base. And I think that project, as I recall, was unique in that we not only focused on training servers, but there was also the focus on the management policies and practices, which kind of tied with your dram shop defense.
Exactly. Server training became just one policy. This came out of work with you, because I remember you, when we would do remember we did trainings together, I'd be kind of the bad cop and say to the, training managers and servers, you're going to get sued if you don't do what this guy tells you to do. And then you would say, and I've got good news, if you do this, it's going to make your business better. You're going to be more profitable. But the thing that we learned, and I remember you saying this to me, and it kind of was like this light bulb went on. You said, when I was a bartender, I realized, that there was a problem here, that people were being overserved, but it was difficult because the manager didn't want the servers to reduce to cut people off, because that was going to be harmful to business. So we shifted the focus from not just the server to the manager, and that was something I learned from you initially.
Yeah, and
Bob
expanded
Saltz's research really, we started really fleshing that out.
And that expanded to the Monterey, Santa Cruz comparison.
That's right.
Site. Yeah, and one of the things that you were doing back then, relating more to your alcohol policy, but you were doing a lot of grassroots community organizing building, and that was something that I learned from you. And so when we worked in Monterey and Santa Cruz, we were able to really mobilize a group in Santa Cruz that supported, the training and the management policies. But that same kind of community network didn't materialize in Monterey. And it seemed that had some influence. So beyond server training and good management policies, how important is mobilizing the local community to be advocates for responsible businesses versus, working to, intervene more proactively with at-risk businesses?
The key thing is the community has to say, this is a problem and we need a solution. And that has to be a pretty strong voice in order to get the stakeholders' attention. So when we did the Santa Cruz project, if you remember, we came in and people were already up in arms in Capitola about all the late noise and disruption that was going on late at night, with the bars closing at 2 a.m. So the city council was threatening the businesses to close at midnight. And so the industry didn't want that. And when we came and approached them, they said, well, if we do this training program, and this research project, can we hold off on this midnight closure business? And that wouldn't have happened if we hadn't had that community voice saying, this is a problem that needs to be addressed. And so, like Mothers Against Drunk Driving did a lot of organizing. We kind of worked off of that. The research was really important in order to educate the community about where the focus should be in terms of an intervention. But I also think your organizing of the industry was really important. We needed to get the bars, the bar owners and restaurant owners to be actively engaged. And of course, Santa Cruz, we had just a terrific restaurant association.
So from your perspective, then, the evolution of your original idea of creating a responsible business practices defense for dram shop, or what was referred to as liquor liability as well, where a person serving a person who's intoxicated or underage, that leads to an injury or fatality, that establishment can be sued. But what I hear you saying is your thought and the whole structure of all the things you did, as well as us, was blending together this idea, well, servers need to be trained, but they'll only do what they're trained if their management and ownership supports them. The owners and managers will support them if there are community incentives, but those community incentives could either come from like what they were trying to do in Capitola, which would be to limit hours, versus an organized association that would work to say, yes, we need to improve our business practices. So those are the components that seem to evolve over time. Whatever happened with the model legislation, I know it was passed in a few states, but what made it so that you didn't think it would be more easily embraced?
It was adopted in Maine and Vermont. We had several states that it was introduced. Essentially, the industry, and by this I mean the producers, the big guys, the guys who have the big clout in state and federal legislatures, decided they didn't want it because they wanted to limit. They just wanted to limit liquor liability law altogether. They didn't want to have this, what I would call it's a pretty heavy hammer. So they wanted to get rid of the hammer altogether, and mostly they did. They've really, most states have a very diluted liquor liability law, or no liability law at all. Like California, where we started, that was the first state. It went from one of the most expansive liquor liability law to one of the most restrictive. And that happened right then in 1982, I think it was. It was right at the beginning when we were working that shift happened. So what I would say happened to the model dram shop law, which I still think is an absolute, one of the best things I did in my work, was that we didn't have adequate public health community stakeholders saying we want this as a compromise in the legislatures, when the legislatures were considering how to make liquor liability law more fair to the industry. They went with what the big boys wanted, which was get rid of it essentially, rather than let's have one that it creates fairness, but still requires responsibility by the servers and the management, because they have a responsibility to the public to keep intoxicated people off the road when they leave the establishment.
Now, I'm going to switch real quick, and this will be the last focal point with our time, but I coincidentally, I just got off the phone with somebody from Orlando, where they've been having a lot of late night shootings. and disturbances by youth and young men who are coming in with a racial overtone to it. And so the city is saying, well, we'll fix this problem by having everybody close at midnight. So it's almost like the same scenario. The difference is that it's not
Right.
impaired driving, which from my experience is no longer atop of the agenda for a lot of people. As it relates to nightlife issues, it's this increasing violence. But from your perspective, is that a solution to go from 2 a.m. to midnight? Is that going to fix all of the problems in the community? Or do we have to go back to what you had said? Maybe we need to focus more specifically on what some of the businesses are doing, recognize those that are doing well and not punish them, but also have a much more strategic intervention with those that weren't doing it.
It's a tricky question to answer, Jim, because there's just so many variables involved. We know from the research that limiting closing hours will have a positive effect in terms of reducing drinking, driving, and probably violence. But is that the magic bullet? No, it's not. And I know that you're working on a variety of issues in the late night area where perhaps other interventions, like we did in Capitola, other interventions could be more effective, particularly if we can make it more comprehensive. I'm not up on the research on the violence issue and its relationship to bars and restaurants and their practices. I would speculate that it is probably alcohol fueled, so that the same policies that we were pushing for impaired driving would be effective in terms of reducing potential for gun violence that's coming out of those establishments. If you lower the amount of alcohol, you're probably going to lower the temperature, the anger temperature, and people aren't going to be pulling out guns as quickly. But that would be something to research. What was very helpful in the work we did in impaired driving was we did get a whole lot of research that really showed that there was this link. And that was important to show the bars and restaurants, the managers, say, this is a real problem. And there's ways that you can address it. And you don't have to close at midnight. You could close at 2 a.m., but you need to really be attentive to these issues and the policies and procedures. The work that Tracy Toomey has done up in Minnesota has really helped flush some of this out. So that's I see the comprehensive approach that RHI has championed, and from a public health standpoint, the kind of work Tracy's doing is going to be more effective in the long run, particularly looking at how can we make these businesses successful and at the same time address the public health problems. And that's why the partnership with RHI was so important to me in those early days.
Well, great. This has been wonderful, Jim. You certainly have a long-term legacy and a lot of legends in terms of the work that you've done. And I'm sure you've helped many more people than me in terms of understanding, these
I appreciate you
new
saying
ideas
that,
and
Jim,
new
and
frameworks.
the same at you.
Okay. Well, this
All
has
right.
been great, and I wish you good luck, and I appreciate your taking the time, and we'll just chat
course,
for a minute
of course.
afterwards.
Great to see you, and best to RHI on their 40th anniversary and all the great work you've done over the years.